Joining me via Skype from Hawaii in the United States is Professor Chima Onoka, a community physician and health systems economist. He shares his thoughts about managing community transmission in the country. It's good to have you on the program with us.
Thank you very much.
Now,
Good
many
to be
people have
here.
been worried about Kano. And, any case at all in Kano is a problem. But what we've seen in the last week is that Kano has recorded over 70 cases. How do you respond to the cases in Kano?
The situation in Kano is quite disturbing. I mean, because we know the figures there and then the way that people live as community in Kano State. So those numbers are there, and I think they are worrisome because once you see a number, and these are confirmed cases based on tests that were carried out days back, not today. So it tells you that there is quite a lot of transmission going on, and so that's a concern.
I want to find out from you, how worried should the government be, as we're witnessing more community infections all over the country? How should the government react to this situation?
I mean, the what is going on now tells us clearly that this is established, and so even if government people were taking it casually, they just need to wake up. Government authorities across board. I mean, and we know that even Kano is challenged already because people who are supposed to be sitting on the table, some are already, being quarantined, and so it tells us that look, it's an alarm phase really, that there's a lot that government should do, even if it's not been doing it. This is not the time for people bickering about money, about who gets what contract. It's not the time who signs what document. This is a time to fix whatever needs to be fixed.
You have spoken before about the inevitable. In fact, what you said was that the government should prepare the population for the inevitable. What is this inevitable situation you're talking about?
The practical challenge that we have is that people are hungry, and there's a limit to which people will stay indoors, even though that is the advice. So you want people to stay indoors so that the virus can, more or less die off. As if somebody is not transmitting it, then the virus dies off, basically. But now people are being forced outside because, one, some are even homeless, and the condition in places like Kano is even worse than places like Abuja. It's a different ball game entirely. Two, people will want to go look for food for their families in places where the kind of lockdown that we've seen have been effective to some extent or to a reasonable extent. Food is supplied to households, directly to households, not crowded households, not places where people are crowded and uncontrollable like we've seen in many places in Nigeria. What that means is that people are already in the streets. They are mingling, they are together. So if there is one person in there while this search is happening, it's all, a place for transmission. So rather than have situations where transmission is uncontrolled, we need to get the people ready. There isn't much of that discussion going on to help with people knowing that, look, this is really serious at the grassroots level, and then, for them to really protect themselves.
Well, you still haven't really pointed out what this inevitable situation is. What is the inevitable situation?
The inevitable situation is an escalation of transmission because people are pouring out to the streets in search of food because of hunger, and then to get food for their households. That's what is impending.
the idea of communities, having this disease in communities has been one that everybody has been afraid of. And, it's a big fear, especially in Nigeria, because, like you pointed out, our communities are not very well equipped, for us to observe things like social distancing and whatnot, and the infection in communities is something that we're beginning to see right now with the community testings going on, so what can be done to flatten the curve in view of the increasing community infection? Because we're seeing that a lot across the country. What can be done to flatten the curve as we are right now?
In some, you see, an area where we are working hard at the moment is in treatment of those identified. The bigger problem is all the people who are before that point of treatment. And the government institution responsible for that is doing a lot of work in that aspect, the NCDC. Now, all the parts, apart from testing, all the parts before that stage has to do with prevention. And so the things about prevention need strengthening now. You see, it's actually not strange. All the countries where we have, it starts the same way. So you have some point people, and then transmission starts, and then community transmission begins to happen, and then the numbers escalate. Lockdown spreads it up so that rather than having 1,000 people coming, meeting the health system at the same time, because one person transmitted it to 1,000, it spreads it out, and then that makes it easy for the system to absorb it. So our best bet, because people are hungry and they're not finding food, and they're hearing all the stories about the economy and the collapse, is that each individual is brought to the point of responsibility to slow the process. And that point of responsibility is the face masks that have been talked about. Face masks, not one person, but face masks for every 2 people that are meeting in the streets. That really means face masks for everyone. Those investments have to happen from the top down to the lowest level. Face masks production, these are the times, and that's why I talked about the health systems approach, and it's even the wider health system, because even organizations like SMEDAN that have been, the small and medium scale enterprises at the national and state level, that have lists of the entrepreneurs, the things that we hear about Bank of Industry, the people that have listed, these are the times to activate all of that, so that even if we are depending on outsiders for materials, for items, for supplies for this month of April and early May, that we have a clear plan for their production locally, so that by that time, we're not talking about, picking things from outside. So this involves a wider group. Apart from the focus, there's a lot of focus, around the ones of treatment, which the NCDC and states like Lagos have done so much to make available. So prevention, we need to do it. And understanding information that is going out. What is the kind of information that those in the localities have in Kano? It's not Twitter, it's not Facebook.
Absolutely.
What information do they have translated to that level? What information is in the mosques? What information is in the churches, where people have, whether they are closed or not, they have a network
where this kind of
they
information can get to them?
Yes. So the engagement of that level is something that those in the social services sector, the humanitarian sector, the information units, that's the kind of research, social analysis that they should be picking up and then dealing with clearly. Because,
absolutely.
I mean, even like Kano, I don't think that those people running around have understood it in their own language, the way their minds understand it. That's not how they've got it.
Information down to the people at their level to help them prevent themselves from catching this disease. Thank you so much for your insights, Professor Chima Walker.
Thank you very much.
Thanks for staying with us. Thanks for your mails. Let's continue the conversations online through the email address and Twitter handle on your screen. Also, be sure to share anything happening within your locality. Don't forget, you can view the program on youtube.com/channelsweb/videos. Remember to wash your hands as many times as possible. It's one of the ways to reduce your chances of contacting the virus. Thanks for watching. I'm Kayla Magwa. Stay safe and see you next time.